Here we go.
All right. Hi, I'm Hannah.
I'm Maya.
I'm Dylan.
I'm Lauren.
And I'm Connor.
And we're doing our project on the effect of prunes on bone mineral density in postmenopausal women. So this is just a bit of the overview of our presentation. All right, so the background on osteoporosis. Osteoporosis is a major public health concern. Osteoporosis leads to low bone mineral density, fragile bones, and fractures. It affects many postmenopausal women. Prevalence is expected to rise significantly. Postmenopausal women experience accelerated bone loss due to estrogen decline that happens with menopause. And medication adherence is low for osteoporosis. Pharmacologic treatments for osteoporosis are very effective, but long-term compliance among postmenopausal women is poor. So this creates a need for a sustainable food-based approach. And prunes show a promise as a whole food intervention. They're naturally rich in phenolic compounds that can support bone metabolism, and these studies suggest that prunes may reduce bone resorption, improve bone formation markers, and reduce inflammation involved in bone loss.
So this study helped us understand three main things. First, the study examined if prune consumption will actually slow the effects of age-related bone degeneration. Postmenopausal women experience rapid bone loss, so identifying a simple dietary habit that helps preserve bone mineral density could be extremely beneficial for many. It also examined how prune intake influences bone-related biomarkers and hormones. These markers are very beneficial for helping give insight into what's happening with bone health. And finally, the study explores whether prunes could serve as an accessible non-pharmaceutical strategy to support bone health. Like Hannah said, osteoporosis medications are often the adherence is low, so finding an intervention that people can easily incorporate into their diet may offer a valuable alternative.
Okay, for the study design and methods, the study used a randomized control trial to test the effects of 50 and 100-gram prunes on bone mineral density and bone biomarkers in postmenopausal women. The randomized control trial lasted 12 months. It was made up of 238 postmenopausal women aged 55 to 75 who all had T-scores for normal to osteoporotic bone density, which is between 0 and the -3. Three randomized groups were formed, one being a control group with no prunes, another group taking 50 grams of prunes daily, and then a third group taking 100 grams daily. The independent variables of this study is whether or not people are ingesting the prunes, and if so, how much. The dependent variables are bone mineral density, biomarkers, and fracture risks. Each month, weight and symptoms were measured from each group. Bone mineral density was taken by readings from a DEXA scan from the hip, lumbar spine, femoral neck, and total body. DEXA scans were taken during this trial every 6 months using the DEXA machine. Biomarkers were taken every 3 months from urine and blood samples. And fracture risk was calculated using FRAX score, which is a tool that calculates the likelihood of one having a major osteoporotic fracture using clinical risk factors to make the estimation. Exercise and dietary assessments were also observed throughout this study.
Okay, so we've seen kind of how we're going to design the study and the complex interplay of how the prunes work with the hormones and the body. And it turns out that taking a 50-gram prune dosage, these individuals, which there was, I think at the start, 252, but there was a few people, there was a lot of withdrawal in that overall number. But for those that did complete it, it became apparent that the 50-gram prune group actually maintained their hip bone mineral density over the 12 months, dropping by only about 0.3%. And the control group, as seen in the graph colored in red, dropped significantly by about 1.1%, which demonstrated that they are at a high risk of having a hip fracture. Yeah, and the two groups on the graph, or the two things we looked at, is the total hip bone mineral density percent change, and then the femoral neck bone mineral density change. The 100 milligram group, however, did not show any added benefit. And what stood out to me was the enormous dropout rate. About 41% of the people in the 100-gram group stopped the trial, which suggests that higher dosage just wasn't as tolerable. Ergo, the smaller dosage became more impactful anyway, meaning that people don't need to subject themselves to through the agony of 100 milligrams a day. Then if we look at our interpretation and key findings, as kind of touched on in the previous slide, our 50 grams a day are going to be the most effective and practical dose. It significantly helped preserve the bone mineral density, and the fracture risk score stayed stable, which is clinically meaningful for us. The 100 milligram dose didn't improve outcomes further, and it didn't. And I guess important to note is that it didn't hurt our people in trial, our women, but it didn't. There's no need to subject yourself to more. So overall, the prunes offer a simple, non-pharmacological way to women, or for women, to support their bone health. And then
So overall, with the 3 diet day plan, we had a few key focus points. A lot of it was increasing calcium intake along with vitamin D. Both of these micronutrients are important for inhibiting osteoclast activity and promoting optimal bone mineralization. The key point to adding vitamin D with vitamin C or calcium is it will help with the uptake of calcium in the body, or the absorption of calcium in the body. Another key point was adding high quality protein sources such as lean meats, dairy alternatives, tofu. This is just key in preserving lean muscle mass and enhancing bone integrity in the body. And then we obviously wanted to include in our diet plan the integration of prunes, just because of the study that we decided to focus on. It proved key points in helping with osteoporosis. So this is our day 1 of the diet. Some key points is that the prunes were just added to the oatmeal and the breakfast. It can be added in many things, and another day it's added in Greek yogurt, so it can be integrated in many different ways. Day 2 of the diet, you see a lot of lean proteins, such as the turkey, and then any sort of juice or drink is usually fortified, like the juice. Again, with this one, we see milk that's been fortified with more vitamins in it. And then you see a lot of leafy greens like kale and green beans. So this is our bar graph. We kept added sugars lower, but as you can see in the vitamin C rating, it was up by 312%, which is one of the ones that we wanted to focus on. Vitamin D was also increased along with our calcium.
And then here are citations, and that's the end of our project. Okay. I think that's